thank you again for being here, and we will start with our CEO of the American Psychological Association, Dr. Arthur Evans, who's just such a visionary and such a delight, such a great, distinct pleasure I have in working closely with him. He is transforming APA, and he's been recognized nationally and internationally for his work in behavioral health care policy and delivery innovation. Dr. Arthur Evans, it's my great pleasure to present to you.
I think that introduction is probably going to be longer than my comments, but thank you very much. I appreciate that. So first of all, I just want to congratulate Beth and all of your colleagues here in Illinois for the work that you've done in helping to get prescription privileges for psychologists. I spent most of my career in public mental health, and I can tell you, as many of you know in this audience, that we need more practitioners, and the fact that you're able to do that. And the thing that I found so impressive about work here in Philadelphia, that's where I was. I do that every now and then, especially when I leave time zones. The work that's so impressive here in Illinois is that the coalition that you built with our colleagues in medicine and public policy and the community, I think it's a real a model for how we can be doing this across the country. And so I want to really congratulate you for this. In addition to the fact that psychologists are helping to close the treatment gap for people who need services, the other real important reason that I think this is so important is that psychologists bring a unique perspective to prescribing. And every time I hear psychologists who prescribe talk about how they integrate psychosocial and behavioral interventions and actually use less medication than maybe some of their other counterparts, it really speaks to the importance of having that perspective in our mental health systems. And so I think we're adding something that's very unique and something that is needed and something that's going to make our systems better. And then finally, for those of you who are in other states who are helping to this movement and getting more psychologists doing this work, I want to thank you all, because ultimately this is about making our service systems better for people, giving access to people, and ultimately making their lives better. So thank all of you who are in this fight. Thank all of you who are helping to make this happen. And thank you again, Beth, for your leadership.